Hello, this is Dr. Daniel Van Ingen. Welcome to the Dr. Van Ingen Clinical Psychology and Parenting Show. I want to talk about You Are Your Child's Best Psychologist, a brand new book that was just released. The title, it captures the message that I want to send, and that it's really up to the parent. But, there's a larger question. When do you seek help from a mental health professional? And so I want to talk about that. When do you seek help from a mental health professional? There are countless reasons when a family would need help from a licensed professional. So I want to present some of the reasons to you now. Kids are so unruly that no intervention seems to work, and your style of communication seems to have no effect. We see that. Behavior analysts can come in and provide applied behavior analysis. And they can do a functional analysis. They can come up with reinforcement plans and behavioral interventions. And specific rewards and privileges, as well as limits, are instituted in an organized, structured way. And they can make a huge difference for your kids. Here's another reason. Your teenager is experiencing a depression that doesn't seem to lift. Look, if teenagers don't have purpose, if they don't have meaning, or if there's a deficit of serotonin, and we know that if there's a deficit of serotonin in the limbic system, they're going to be more biased towards negative information. And if there's a deficit in other areas, the basal ganglia, a deficit of dopamine, they're going to feel less pleasure about things. And so for various reasons, whether it's chemical or existential, not having purpose, or other reasons, the depression doesn't lift. For a short period of time, a mental health professional can make a huge difference. The kids are having significant difficulty coping with significant loss. Yeah, if the dad passed away, that may be a very critical time to have talk therapy for the kids. If your child is showing signs and symptoms of obsessive compulsive disorder, the treatment modality there is exposure and response prevention within a cognitive behavioral therapy modality. And exposure and response prevention has ample scientific research to show its effectiveness. Your child is overly concerned about being humiliated. They avoid social situations, and they appear to suffer from social anxiety, which often starts at the age of 13. So in these situations, group psychotherapy is extremely helpful, specifically cognitive behavioral therapy. But essentially, we want to address three things: their anxiety, their avoidance, and also their skills, their communication skills. They don't know what to say, so we need to help them figure out what to say in different settings. And you're going to see more of that with accommodations and 403B plans. And you're going to see more anxiety with an being overly dependent on smartphones. Say your family has experienced significant trauma as a car accident. And this car accident has led to intrusive memories, flashbacks, sleep problems. Your child hasn't slept since the accident. Seeing a mental health professional in that situation may be most helpful. Say fears have overwhelmed your young child, leading to acid reflux, headaches, diarrheas, frequent accidents. And the nurse has been visited on several occasions. Maybe there's a fear that needs to be addressed. Your child has developed unstoppable or impulsive habits of skin picking, diagnostically called excoriation, or pulling hair. They're just doing this, and it's a habit, it's unstoppable. That's trichotillomania. Or hoarding behaviors. Mental health treatment may be needed. Say obesity has become an issue, and there's been too much TV, too much video games, and too many processed foods. Not enough cooking, rushing, feeling like you're doing things too fast. You want to change course, and you're going to experience a lot of resistance. Yes, there's resistance if you talk to your son at age 11 about putting a limit on video games. Well, from age 9 through 11, there was no limit, unlimited video games. Yeah, you're going to meet some resistance. There's going to be a defensive wall you're going to meet. And in those situations and others, a mental health professional can make a huge difference. Say you're noticing your daughter binging and purging, vomiting up a ton of carbs consumed, or there's a preoccupation with body image. You see that more and more now with boys as well. Say your student athlete is experiencing psychological blocking in his or her sport and is locking up with previously learned skills. Maybe they're giving up and quitting on tennis matches, or they're avoiding the gymnastics floor routine because of a previous fall. Sports psychologists can provide significant help. And yes, you want optimism. You want to see problems as temporary. And a mental health professional, a psychologist with a skill set in sports, can help move past the blocking. Your kid is showing learning discrepancies with a bright intellect, but underdeveloped math, reading, written expression, writing. Maybe they just need to read some more books. But look, if there's a processing disorder, a dyslexia, or some kind of specific learning disorder, a mental health professional, a psychologist, can help a lot with that. So, rather than see it as a sign of weakness, and I know parents, it's a stigma, and I know parents hold that. I talk to a lot of parents and they still hold those views. Instead, see professional help as a sign of strength. Look, we all need a support team to be successful. Name any successful person, they need a support team. We need a success team behind us. And during this, what I call winter season of life, treatment may last 4 weeks, maybe 3 months. Very often it's 6 months to 1 year. And in rare occasions, it's 2 or more years. But it is for a period of time. It has a beginning and it has an end. And I think that's the key to looking at it. And where do people go? Many people nowadays, they go to psychologytoday.com or a similar path to find a therapist. Or you may go to a mental health organization if one of the problems that you're facing is an anxiety disorder. I strongly recommend the Anxiety Disorders Association of America, www.adaa.org. It can be a great resource, and you're going to get a mental health professional who has a specialty in anxiety disorders, and it's going to be temporary. It's going to be temporary, and it's going to be a set period of time, 25 to 30 sessions or 15 to 20 sessions, and that therapist is going to work with evidence-based practices and apply interventions that are based on research. Other specialty organizations include the American Board of Professional Psychology, that's ABEP or abpp.org, or the National Registry of Health Service Psychologists, that's nationalregister.org, or for those of you who want to talk to a Christian counselor, the American Association of Christian Counselors is www.aacc.net. So there you have it. That's where people go for those kinds of problems that I mentioned. But then there's everything else. There's everything else. And we want more from parents. And parents need more tools. In my book, You Are Your Child's Best Psychologist, it covers everything else. And besides those problems I just mentioned and maybe some others, there's everything else. And everything else is 99% of your children, of their development as preteens or as teenagers. And look, we provide a number of tools. With my wife, who's an education professor, with our 15 years and thousands of hours of combined clinical and educational experience, 65 comprehensive interviews of parents, and thousands of interactions with parents and professionals, and a thorough review of the psychology literature on parenting over the last 100 years, we identified the 7 keys to optimal parenting. 7 keys. And explaining the 7 keys in our book, we develop words of wisdom and steps for taking action for parents. So it's very concrete and step by step. It provides parents a knowledge base and specific skills to strengthen each of the 7 keys. We've also included in each chapter reflection tips and reflection exercises. And here, listen to some of these. 6 steps to replacing fear of embarrassment with boldness. The 4 levels of communication. A 5-step plan for building optimism with teenagers. Applying the golden keys to storytelling. We need to share our life with our kids. Family, dinner, conversation tips. The 5 steps to raise your child's internal locus of control. What is internal locus of control? It is the key to self-efficacy. It is the key to your kids growing up and believing that their effort will determine outcomes. It is the key to their success. Check it out. You'll find out what internal locus of control is by reading it in the book, You Are Your Child's Best Psychologist. Or teaching change talk versus stuck talk. Yes, our teens, our preteens get stuck. So there's all kinds of tools that the book will capture. Check it out. You Are Your Child's Best Psychologist. 7 keys to excellence in parenting. And folks, everything else, 99% of raising your children, it's on you. And it's having that success team, but it's on you. And check out the book. We cover virtually every problem that exists that parents are facing. And it is tough. It's not easy, but raising children in this culture nowadays, in this society, it is tough. So you need this book. It's a great resource. Go now to Amazon.com. Go now. Order your book. Pick up your copy. You're Your Child's Best Psychologist. 7 Keys to Excellence in Parenting.